So what is this bolder metric of health that we should be looking at?
I think it's an evolution of where we ultimately need to get to in the industry, and we're certainly working on it within Kaiser Permanente. If you stop and look at historically how we've measured like quality and the assumptions of quality, a lot of it has been based on process measurements, right? So you make an assumption that if you do certain things will happen.
Right.
So I think we're all starting to evolve much more to outcome measurements that is more relevant to the functionality of the person, if you will, as opposed to just the centerpiece being on the care provided itself. I think the second part is, really thinking through the uber messages of measurements, if you will, which for us is starting to really get better defined around the healthy life years of individuals. So how do we start to quantify health over the lifespan of a person? And what are the things that we need to be working on and doing with the people to assist and to partner in better health for the long term? That lends itself to a question about, as I call it, which lanes should we be in? And it starts to force the rethinking of the ecosystem of health that would suggest that we should think broader than just being in the medical care lane. Because there are other determinants and factors and behaviors that, in fact, will impact the healthy life years of individuals much more than the intervention of medical care.
In my opener, I talked about the inputs and outputs of health and that we weren't fully cognizant of what those would be. But in the case of paying for health in health care, those inputs and outputs are also somewhat misguided too, as you point out. I mean, most of where we spend our money in the last couple of years of life, basically prolonging people whose life, in many cases with very difficult interventions, is phenomenally expensive. And that's where our investment is. But we're not investing in the systems that would help create those healthy life years earlier. So how are you changing that model?
Well, but it goes back to, I don't think that all of that fits into the lane of just medical care. So if you stop and think about, and I think Ariana kind of touched on this earlier about lifestyle behavior changes, those types of things. You think about the whole ecosystem around an individual that impacts your health, where you live. Do you live in areas with the infrastructure that lends itself to healthy lifestyles, healthy behaviors, how well you sleep, those kinds of things that comes into context in a very different way. I also think that as we continue to work on this together, the question is, how do we invest all the dollars in a longitudinal way that allows you to early on get to early detection, early diagnoses, early treatments, and to move away, at least in our experience, from episodic care being the solution, waiting until something happens. And I think now with the data that's available to us, and as we're learning more with the use of data, as well as technology allowing us to begin to think very differently, there are different ways that you can monitor and oversee, and some of the great things that our Permanente physicians are doing lends itself to that kind of practice changes that are going on.
And you talk a lot about high touch, high tech. Tell us rather, some of the technology that's sort of coming into play now that you think is game changing.
Well, I think you stop and think about the ways in which we can monitor and assist our patients and members at home. So the home environment, things that will not require you to physically come in necessarily for an appointment. I had something on my leg that was bothering me, and I wanted my dermatologist to take a look at it. And I simply, you want to work on it? It's still, I got a little Band-Aid on it now, see? And was able to take a picture of it and beam it to the doctor and take a look at it. And then set up a virtual visit and get all that done without me having to come in.
And you want to move people out of the hospital setting. You want to move them into their homes, where they are, their offices.
Right.
Yeah.
Yeah. And then you have, you have where we can have opportunities for our members to decide with the physician, should I come in for a physical visit or can I do it virtually with telehealth and telehealth capabilities? Being able to make an appointment online, to be given those choices, and then in agreement with the physician to decide what's the best approach to look after you.
Now, you got some blowback recently for a telemedicine visit in which somebody was told they had a terminal disease in that. And you said that it was unfair in terms of the criticism that you'd gotten on there. But talk a little bit about how you sort of make sure that those technologies are also being used sensitively.
Yeah, I wouldn't say unfair. It wasn't factually all correct, right? So the idea that we would have as they call it, a robot to go in the room to tell a patient you're going to die.
Right.
I mean, we would never do anything like that.
Right.
So what was missing was the whole team approach that happened with the doctors going in earlier, and this is an extension of that. And the idea that a robot is going in by itself and going to provide that's not the scenario itself.
Right.
And having a professional in the room, a nurse or a physician, etc. But it is a lesson on, and what we did talk about within Kaiser Permanente is to make sure that the high touch, if there's anything else we need to learn with the high touch, is what else do we need to do to make sure that at any point our members or the family are not feeling that the tech has taken over the touch. And it's a reminder that the personal interaction and healthcare is still about touch, must be present at all times.
You know, I mean, you obviously invest as a healthcare CEO and as a hospital CEO in technology and buildings and, you know, all of the resources that you need to run these massive hospitals. But you also have put huge investments in things that, you know, some might say we're sort of outside of the, you know, main highway for healthcare, the social determinants of health. You've invested in homelessness, in, you know, all sorts of, you know, mental health interventions that are outside of the traditional healthcare lane. Talk a little bit about that and why social determinants are more important than ever.
Well, in our model at Kaiser Permanente, and by the way, we use the term, our line of sight is 1366 right now. It's approximately 13 million members that we almost have.
That you almost have.
So we're at 12.4 million technically.
When I talk to you next month, we'll update.
And they live and exist in communities of 66 million people.
Right.
And so we are as engaged and involved in the infrastructure of those communities that are taking care of, that 13 million people are living in and or 66 million are residing in. And so it is in that vein that we look at what are the determinants of health that we should get actively engaged in, whether it's directly through initiatives like our $200 million initiative on the homeless and affordable housing, to advocacy around things like gun prevention and how to deal with gun violence or gun injuries without getting into the political debate of whether or not people should own guns.
Right.
And so it is because we don't view ourselves as just a medical care program, we're a health system. These items become critically important as part of helping our members and helping our community maximize their health.
I would love to get some comments, questions from the audience. So if you want to have a question or say something, please make yourself known and we'll get a paddle over to you, one of our runners. So while we're waiting for that, you know, it is so unusual, though, for someone, if you think about who your customers are, you're saying that you're not just thinking about your 12.4 million customers, you're thinking about the 66 million people who are neighbors of your customers, who live and work with your customers. You know, it's a completely different change of thinking, a mindset. You know, how do you make sure that you are providing, you know, benefits from that for them that, you know, that are really serving your customers most of all? I mean, how do you, as a CEO, you must have to pick and choose what you do.
Yeah, right. I mean, we don't ever miss the main thing, which is our members and our purchasers, customers, pay us to provide high quality care and services to our members, their employees or family members or et cetera. So we don't miss that at all. But we also have an obligations to the communities in which we exist as a not-for-profit 501c3 corporation, if you will. Right. And so we don't forget that line of sight as well. Right. I think where we have complete alignment, the issues that we're working on with our members are also of benefit to the community and vice versa. Mm-hmm. So it's not like we're doing something unique for our members and then we have to think of something else for the communities. These issues covers the entire community. Yeah. And so the homelessness issue is one example of that. Do we have
we've got one right there, please. Could you just let us know who you are too?
Sure. I'm Megan Jones-Bell. I'm Headspace's Chief Science Officer. I know that you are really forward-thinking around mental health, and particularly the integration of digital mental health solutions with in-person care. I'd just love if you could share any learnings about what's actually working around that integration of technology and that high-touch service.
Well, and I'm glad you asked that. First of all, we believe strongly, as I described it, that the mental metaphor, if you will, is how to reconnect the head to the body when we think holistically about a total health agenda. That has led us to really rethink everything from how do we design now mental health services that is attached to the body. And that has led to, in some of our, for example, primary care facilities and areas, we've added now mental health services where the handoff is seamless like it is in any other part of the practice within the Permanente medical groups. And so we have been very comfortable, for example, if you went in with a pain in your knee and you went to see your primary care physician, and then all of a sudden that primary care physician wants you to see an orthopedic specialist or someone, that's a smooth handoff. Well, that's the same concept we're using in some of our facilities that we're looking at driving that kind of approach as well. And then in addition to that is how to use technology in which it works for the patient and it works for our specialists to provide mental health services where you might be dealing with an acuity level of mental health services that it lends itself very well to the use of access through telephonic and other methods. I think also we're looking at what other types of technology we want to introduce that serves as early warning signs for our members and for our delivery system that will allow us to be more proactive in the prevention of episodic things happening as we go along as well. And that lines up very well with our model and with how we have always designed the practice of care by our physicians and others in the Permanente medical group of Kaiser Permanente.
We have another question. Can I also ask you about the cost of care? Because all these interventions are expensive, and you have such an ambitious agenda for change. Talk about how you can control some of the cost of this.
If we don't hear anything, one of the things we should all hear is the cry that healthcare is unaffordable, period, right? So I don't start with affordability equals let's manage our cost structure. Affordability starts with really understanding what that means for what's coming out of people's pocket for us to do what we need to do. Mm-hmm. In that vein, I think that as we're talking about the opportunities to continue to transform how we deliver both care and coverage and everything that makes up healthcare, we have to rethink how we're going to rebase our cost structure from our investments that we make that produces different results for our members and for the American people in this case. I also think that we have to deal with how we arrest the escalation, the trend of the cost that goes up every year. That is the challenge that we have in front of us. And so if we are, for example, investing a lot in the technology to create new access points through technology, that is a very different cost structure than building a medical office building, having staff everywhere, all those kinds of things. Over time, you got to reconcile those two financial models, if you will, in which the results are different. At least in our case, we're still working through that, because as we create more convenience, people are using it even more. And we need to figure out how much of that fits into the lifetime cost as opposed to the episodic care.
Right. Well, thank you very much, Bernard Tyson.
Thank you.
CEO, Kaiser Permanente. Thank you.
Great to see you.
So great to see you as well.